Hi, this is Johannes Huitink, anaesthesiologist based in the Netherlands and the founder of the Airway Management Academy. Today I will show you a tip and a trick with the video laryngoscope, how we can use it for awake tracheal intubation. There are patients who cannot lie flat, or we cannot approach from backside of the body. We can approach them only face to face from this side of the patient. For example, patients who are obese or patients who cannot lie flat. For example, this patient has high flow nasal oxygen at 60 liters per minute. He's dyspnoic and we have to intubate him face to face awake. So when we do this, we can topicalize the airway, we can use a bit of sedation, and when we're ready to intubate, we would instruct the patient just to breathe normally and be comfortable. And then I will take the video laryngoscope, and here we have the HEINE video laryngoscope with the HEINE 3 blade, so it's a little bit hyperangulated blade. And I don't hold the laryngoscope in my left hand, no, I hold it in my right hand. And there's something else we do, we flip it. So I hold it upside down. And if you look carefully, this looks like a Tomahawk. So this is the idea. And the good thing with this video laryngoscope is this screen is very mobile. I can turn it in all directions, and this is very practical if you do a face-to-face intubation. So I'm on the left side of the patient. I will introduce the blade over the middle of the tongue. We'll try to get the best view and engage the vallicula. And here we see the vocal cords. The patient is awake, so I don't pull on the blade, and you can see epiglottis. You can see the vocal cords. In a real patient they would move now because the patient is awake. And then my assistant can give me a bougie. It's also very practical to use a bougie. And we intubate the glottis with the bougie. You can see it on the screen, and this takes a bit of eye-hand coordination. And we put it in the glottis. You can see it clearly. And the patient may cough a little bit because he's awake. And when we confine that the bougie is in the trachea, we just need a tube. And then you can help me push it around the bougie. Yeah, there we go. If you hold the bougie, we can carefully intubate the patient. And this is maybe the moment you give a little bit of propofol to make the patient comfortable, and the patient can be intubated awake. This is the idea. Thank you very much. So do we do this in the hospital face to face because patients cannot lie flat? But if you work in the pre-hospital setting, for example with HEMS teams, helicopter teams, or I work in air ambulance, we sometimes don't have access to the head of the patient. And this is an excellent technique to be able to intubate patients face to face. So remember, hold the video laryngoscope like a Tomahawk and use a video laryngoscope with a big screen that can be turned in all directions. Thank you very much.